Welcome back to YouTube. Today, we'll explore a topic often overlooked, vulvar variations. While discussions about penis size are common, vulvar diversity is frequently ignored. This video aims to address this gap in knowledge. Many men and women are unfamiliar with the diverse range of vulvar appearances. It's important to remember that the vulva, the external female genitalia, is far more diverse than often portrayed. The visible parts are only a fraction of the entire anatomy. Before we continue, remember that accurate information about sexual health and anatomy is crucial. Reliable sources, such as those provided by organizations like Planned Parenthood and Scarleteen, offer comprehensive and fact-based education. These organizations provide accurate information regarding sexual health, encompassing various aspects of anatomy, health, and well-being. They frequently update their information to reflect the latest medical advancements and research. Let's start with a crucial distinction. The vulva and the vagina are not interchangeable terms. The vagina is the internal canal, unseen externally. The vulva, on the other hand, is the external anatomy, visible to the eye. It includes the labia majora, labia minora, clitoris, urethral opening, vaginal opening, and Bartholin's glands. These are all external components visible during self-examination. Regular self-exams are crucial for recognizing any abnormalities or changes. It's also important to note that the hymen, a thin membrane sometimes present near the vaginal opening, has no reliable correlation with virginity or sexual activity, and many factors can cause variations in its appearance or presence. We'll be discussing vulvar variations, not vaginal variations, as the vagina is an internal organ. Experts have identified numerous vulvar variations, and the classification used can vary. One categorization system describes around 10 types based on the relative sizes and appearances of the labia. Another system, developed through observations made during professional hair removal, categorizes them into 5 types. For the purpose of this video, we'll look at 6 common variations. First, the fortune cookie type. The labia majora completely cover the labia minora, clitoris, and openings, leaving only a small slit visible. Second, the large labia majora type. The labia majora are significantly larger, completely obscuring the labia minora. Third, the small labia majora type. The labia majora are smaller than the labia minora, which are more prominent. Fourth, the large labia minora type. The labia minora are significantly larger and more prominent than the labia majora, sometimes protruding visibly. This prominence might be due to natural variations or other factors. Fifth, the small labia minora type. The labia minora are very small and thin, often lying close to the clitoris. Finally, lipstick vulvas refer to instances where the labia minora have a color significantly different from the surrounding skin. This is a normal variation, as the labia's color can differ from the skin tone due to the presence of underlying blood vessels and tissue. It's also important to note that surgical procedures such as Labiaplasty and Vaginoplasty are increasingly common. These procedures aim to alter the appearance of the vulva, often to meet perceived societal beauty standards. However, it's essential to consider the ethical implications of undergoing such procedures solely to conform to these standards. The decision to undergo cosmetic surgery is highly personal. Seeking guidance from medical professionals and mental health experts is advised before making any decision related to cosmetic procedures. Remember, every vulva is unique and should be celebrated. Your vulva is beautiful just the way it is, and importantly, the way you feel most confident in it. Self-acceptance and body positivity are vital to overall well-being.